Understanding the oxygenation of the heart and its blood circulation. The coronary arteries. The heart is a muscle fueled by oxygen, which is delivered by the coronary arteries. Any reduction in the oxygen supply can have serious and sometimes irreversible consequences for the heart. Let's take a closer look at the coronary arteries. The two coronary arteries, the left and the right, are located directly on the heart. They branch out through the entire cardiac muscle. The coronary arteries are the first to leave the aorta. Their starting point is found immediately above the aortic valve. Patients who have their coronary arteries repaired through the installation of a metal stent are often curious to know the name of the repaired artery. Here, then, are a few details on the anatomy of coronary arteries. The left coronary artery splits into two branches right after it leaves the heart. This first segment is called the left main coronary artery. One of the branches descends along the front of the heart. This is called the left anterior descending artery. It runs along the anterior intraventricular sulcus, i.e., the groove where the heart's two front ventricles meet. The arteries that branch out from it are called the diagonal branches. The circumflex artery is the second artery that stems off of the left main coronary artery. It follows the contour of the heart on the left side, and the marginal arteries branch out from it. The right coronary artery follows the contour of the heart on the right, and in 9 people out of 10 descends behind the heart towards the apex. It follows the posterior groove where the right ventricle meets the left ventricle. This part of the artery is called the posterior interventricular artery. In 1 person out of 10, the posterior interventricular artery is a branch of the circumflex coronary artery on the left side of the heart. Blood circulation in the cardiac muscle is particular. Contrary to blood circulation in the body, the blood stops flowing during a contraction. In fact, the contraction of the cardiac muscle crushes the branches that penetrate the muscle to oxygenate it. Blood circulation is thus cut off during the contraction of the left ventricle. The blood can only pass through when the heart muscle relaxes, i.e., during its resting phase. Despite this, the heart's oxygen requirements are met in a very effective and amply sufficient way. The human body is designed to sufficiently oxygenate this motor in charge of circulating oxygen and vital nutrients throughout the rest of the body. In fact, even a third of the time it takes red blood cells to pass through the capillaries would be enough to deliver oxygen to the cardiac muscle. The capillaries are the microscopic vessels where red blood cells pass through in single file to release oxygen into the muscle and take away the carbon dioxide generated by the heart's work. Everything works perfectly as long as the need for oxygen is in harmony with its supply. Now let's look at the 4 factors that determine the heart's oxygen, O2, needs. We can compare them to the factors that affect a car's gas consumption. Consider the state of the air filter. Ideally, it is well cleaned. The car's aerodynamics. The power of the engine. The speed of the car. In the heart, oxygen needs are determined by the adequate filling of the left ventricle. It must be neither too empty nor too full. The left ventricle's resistance to emptying its contents into the aorta. The strength of its contractions. The heart rate. In the case of certain diseases, like angina, the doctor prescribes medication to reduce the heart's efforts and its oxygen, O2, requirements. The medication acts on one or several of these oxygen consumption factors. As for the oxygen supply, this depends on the quantity of red blood cells present in the blood. These are the little boats that are responsible for transporting oxygen in the blood. The oxygen supply also depends on the state of the piping that irrigates the heart, i.e., the coronary arteries. These arteries, like all of the body's other arteries, are composed of 3 layers. The inside layer, called the intima, is like a thin layer of Teflon. The thicker middle layer is made up of muscle cells. This is the media. It allows the artery to spasm, i.e., to contract and dilate. It is also the place where cholesterol plaques build up and give the arteries a yellow hue when viewed from the inside. Nitroglycerin, which is prescribed to people who suffer from angina, works to dilate the coronary arteries by acting on the cells in the muscle layer. The layer that acts as an exterior covering is called the externa, or the adventitia. It is the most resistant part of the artery and serves to protect the vessel. At birth, the inside of the coronary arteries is smooth and pink, but the media alters with age. It loses its suppleness, causing the arteries to harden as we grow older. Visit iCardio.ca to discover a wealth of information on cardiac health.